Hi, and welcome to another episode of Oral Wealth, Prosperity and Practice. My name is Jackson Sadler. I am an oral and maxillofacial surgeon practicing in the greater Charlotte, North Carolina area, and I'm joined here by my co-host, Mr. Brian Swilling. He is a financial advisor and co-partner of NaviPath Financial here in Gastonia.
Well, technically Charlotte, but
Charlotte.
But I have office here too.
Gotcha. Charlotte and Gastonia, North Carolina. So we appreciate you all joining us again for another episode. As we mentioned at the end of the last episode, today we're going to be broaching the subject of dental employment agreements. It's probably going to end up being a two-part episode. It's a lot of stuff to cover, but at least initially we want to touch on a few of the things that just kind of reinforce the urgency of the importance of understanding how to navigate a dental employment agreement and the ways that it can shape not only your paycheck and your take-home income, but also the way that you're able to practice and the places that you're able to practice. So again, we'll be breaking down the terms you need to know, clauses that raise red flags, and how to approach negotiations with confidence. And this is important because whether you're, reviewing your first associate agreement or preparing to join a larger group, this conversation can help you avoid some of the missteps that, can quietly take away some of the enjoyment in your career.
Yeah.
Sometimes not so quietly.
Yeah. And I'm excited to be here. I think this is a very important topic that I've seen come up a lot, and you've experienced personally.
Oh yeah.
So, we're gonna, in general, contracts shape more than just your paycheck. They shape your freedom, your schedule, your future options. So we're going to get into, a little bit more details. Signing your first contract should feel like a milestone, or even, the next one. Cause you could have, like we talked about earlier, you have your first one, which is like a big step, but it might be your second one that is the best option.
Sure.
Whether that's your second associate job or you end up being in private practice.
That actually brings up I don't want to interrupt you, but that actually brings up a point that that I think is important. As you all are going through your dental employment agreements, and especially for people who are doing this the first time, it definitely can be nerve-wracking. It can definitely be really stressful. I remember it being stressful for myself at the time. And I had a couple of advisors. I had someone who ran a large group private practice and worked with several, had a lot of experience doing dental employment agreements for hygienists that they would hire, as well as associate dentists. And I still did not really feel that comfortable with it. But the advice that I would give you is advice that I was given by one of my attending surgeons, Dr. Patrick Moore. He told me, he said, Jackson, most people's first job is not their last job. So while this is important and it can be nerve-wracking and you can definitely get yourself into some less than favorable situations, it's important to remember that as long as you don't sign a contract that's got like a 20-year term or something like that, you can pivot. You can recover from some of these pitfalls if you've already fallen into them.
Yeah. And we'll talk about, the details of the contract in episode 2, but most contracts are at least a year, sometimes 2. Mm-hmm. And if you sign a longer contract, we'll talk about it, but you should have money up front if they're going to lock you in for a long time.
Sure.
So we'll go into those details. Like Jackson mentioned, for many dentists, it's the moment when they sign that first contract, they unknowingly, if they're not prepared, get themselves, give up more than they gain or get themselves in a bad situation. You got to focus on restrictive covenants, vague termination clause, unclear production-based pay. Those are just some of the traps we'll discuss today. There's one, study the ADA did. It's called the ADA's Legal Guide. Some dentists sign agreements that allow employees to reduce their salary at will, restrict future job opportunities for over a year, or require repayment of a signing bonus if they leave, even for legitimate reasons, which we have real life examples. So you really have to be aware of what you're getting into. Like Jackson, you'll still be uncomfortable even if you talk to advisors, but make sure you get the advisors around you, your mentors, get the advice before you sign.
Before you sign, yeah.
Yeah.
But I mean, honestly, I and to Brian's point, I think that to his point about people being somewhat uncomfortable whenever they ultimately do sign the agreement, some of that discomfort, I think, is just associated with the fact that it's a big decision.
Yeah.
It's not necessarily that you're making a poor decision or that you haven't done your due diligence. Now, if you haven't done your due diligence and you feel anxious, then that's completely warranted.
Yeah. Yeah.
But if you have and you still feel some of that anxiety,
it's normal.
Yeah, it's a big decision. It's your career, especially not to minimize the importance for mid-career and later career dentists, but particularly for new dentists. If you've done all of this work, you've taken on this debt, you've invested a significant amount of your time and energy into this profession, and now when you're supposed to start seeing the fruits of your labor, you realize there may be other things that could prevent you from enjoying all of the benefits, all of the work that you've done thus far. So that's really what we want to talk about. We don't want anybody to do all of that work, to take on all of that responsibility in the form of debt and patient care, and then still not be able to take care of yourself and your family.
Yeah, and the reason we chose to do this episode now is because it's top of mind, right? So I've dealt with clients recently that had contract negotiation, and you were currently working through a revision to your contract.
Yep.
So it's and that's what this podcast is going to be: things that we see, things that Jackson is experiencing, and realize that we're not an isolated event. That other people are also thinking about this stuff. So I think next we're going to go over some common pitfalls. And Jackson, you have a few that you want to discuss, right?
Yeah, there are a couple that I think are important, and you actually touched on one a little bit earlier. So one of the things that it's this it's the legalese, it's terminology. Just like people say sometimes that dentistry is a different language. Yeah. Sometimes I'll be going through my exams, and it's actually kind of funny because I've done it so many times. I have it memorized the way that I need to go through it, and I just kind of spit it off. And I have patients sometimes look at me and go, what did you just say? What was that? And it's similar with legal contracts. They have their own jargon, they have their own language or way that they're used to speaking. And just like we had to learn for dentistry, we've got to learn this for our contract negotiations.
And it's funny, that just brings up a point. I'm going to interrupt you for a second, but like that's the same thing I struggle with every day, is talking personal finance, financial, without using jargon.
Sure,
because that turns people off, especially because it's money, right? They're uncomfortable at the dentist. They're uncomfortable talking about money. We actually have a similar situation where we have to get rid of jargon to make our clients or patients, feel more comfortable.
Yeah, and actually understand.
Yeah,
really be able to make the best decisions for themselves.
Yeah, and that's what we'll try to do. And legal's the same way, right? Yeah. I mean, legal's probably the worst because they're specific. They're trying to be confusing, right?
Yeah, sometimes.
Yeah, some contracts just have a bunch of language in it that is useless.
Yeah, just
to kind of throw people off.
Yeah,
or be like,
your brain shuts off, so your eyes start glazing over, and you stop reading. You don't know what happened. It's the thing where you read a paragraph and you look up and you go, "What did I just read?"
Yeah,
it's like I don't have no idea what I just looked at.
Yeah, you just look at it and you're like, "Okay, I can't read this whole thing."
Yeah.
But let's go to common pitfalls.
Yeah. So like the one that you were mentioning earlier, that just made me think of it. Bonuses, so that's a thing that like it's tricky because some bonuses are really bonuses and some bonuses are golden handcuffs.
Yep.
So in some of these agreements, they'll have things written out as a signing bonus, and the important thing for most people to determine is whether this is a true signing bonus or if it's a retention bonus. Bonus. So the difference there, just very quickly, retention bonus is basically an amount of money that you get paid upon signing that says if you leave before a certain period of time, 12 months, 18 months, 24 months, whatever it is, you have to repay all or a portion of that money. So if you know that going in and you don't plan on going anywhere, then that should be totally fine. But if you want to retain your freedom, you want to retain the option to move to a different city, to practice in a different office, and you decide that you're going to leave after 8 months, a year on a contract that's got a 24-month term, then you may owe them half or all of that money back, some percentage of that money back. Versus a true signing bonus, they give you the money and that's just yours. They can't have it back. They can't touch it. They can't say anything to you about it. So that's a big one that I've seen, just because people get excited about the bonus and you see, oh, I'm getting an extra $15,000, $20,000 straight out of school. And that's great. You should all be, pressing for that. I think that's a reasonable thing to ask for, depending on the setting that you're practicing in. If you're in a rural dental clinic, that may not be the case. If you're in a hospital, they may not give you that. But especially for DSOs and large group practices, I think it's worth discussing for sure.
That's what I was thinking. I haven't seen where there's a signing bonus or retention bonus for dentists unless it's a big group practice or a DSO. Sure. Mm-hmm. So most of your private practices aren't going to do a signing bonus. Have you seen that ever come up?
Well, to be honest with you, the employment agreements that were presented to me were from DSOs or multi-office practices. Yeah. So I didn't really look at a whole lot of offices that had, just one practice or maybe two practices, but yes, that would not be surprising to me to know that. But then that comes around in other ways. You may have a higher opportunity to get equity in the practice when it's a smaller practice versus one of these larger groups or a DSO. So, it's all just about making sure that you are being compensated in one way or another, and that you recognize exactly what that compensation is going to look like. So none of it's surprising you don't end up making less money than you think you're going to make.
Yeah.
Another thing that trips a lot of people up, non-competes. So that's been in the news recently. The FTC, I think, was making the claim that these non-compete agreements are not enforceable. And just so everybody understands what we're talking about, non-compete agreement is basically a clause in your dental employment agreement that says that you agree not to practice within a certain radius of the office or offices that you're currently associated with. So the argument that the FTC was making was that these are not enforceable. They can't say that you cannot work in a certain area because it kind of goes against capitalism and
free trade.
Exactly. However, that is somewhat in question, and they're still trying to work out exactly what that's going to look like. But the important thing for people signing a dental employment agreement the first time to recognize is that the language in the non-compete clause, it typically will say something like, you can't practice within 10 miles, 15 miles. And you may think, okay, I live here 10 miles. It's a little bit far, but there are other offices and I can still live in the area and work in the area. But if it's 10 miles from all of the offices that they own, which I think would be hard to enforce, but you would still have to worry about it. You still have to navigate it and figure out if it's enforceable. And that could basically push you out of the city that you currently live in if they have enough of those offices. And another thing to consider is that it's very interesting to me, it's not 10 miles, like you put it in your GPS and, oh, it's going to take you 10 miles to get here. It's, as they say, 10 miles as the crow flies. So 10 miles in a straight line that way or that way or that way.
Yeah.
So
like if you go on Google Maps and you put a 10-mile radius circle, everything that falls in there,
right.
It covers. And especially in an area like the Charlotte area and the surrounding areas, 10 miles is a lot of Charlotte.
Right.
10 miles could include like 2,000 offices so much. Like,
sure.
It's crazy. Just because, we're in a more, urban area. But I've also seen, these are usually in the restrictive covenant section. So if you're looking at your contract, the restrictive covenants section usually has the non-compete. And occasionally I've seen where you have restricted covenants around what types of services you can provide in that region. Mm-hmm. So
some of them do require you to be like full-time. Well, I guess if you're leaving, that doesn't matter. Never mind.
Yeah, sometimes what I've seen, and so a lot of times this is when a dentist is buying another dentist's practice or partnering, but it's like you can practice within 10 miles, but it can only be hygiene checks.
Okay.
Right.
I got you.
For general dentists.
Man.
So, because that's the flexibility to, I guess semi-retire,
mm-hmm.
go just do hygiene checks. At least that way you're not having patients come to you for productive work.
Mm-hmm.
Right. So yeah, that's a good section. And then,
compensation models.
Yeah.
And I think the important thing about, compensation models is understanding really the difference between production and collections and understanding which one of those your pay is going to be based on. So, I mean, you could be just straight salaried employee where you don't really have any incentives, whether if somebody comes in and sits in the chair or not, you're getting paid. And then you also have production based where if you do the work, now that the work is done, whatever your office's fee is for the work, you get paid a percentage based off of the production. And then also collections. So collections, obviously the difference there between that and production is how much you are actually able to collect from the people you've done the service for. And that's always lower than your production, just across the board for pretty much everybody. It's always lower.
Yeah. I mean, the best practice is 90% collections.
Yeah. 90%. Yeah.
95.
Yeah. 95 is excellent.
Yeah. It depends on the type of practice, obviously, but
yeah. But it's, it's always going to be somewhat difficult to get your money from people because they don't want to come to the dentist in the first place. They definitely don't want to pay for going to the dentist. Which, understandable. That's why I brush my teeth every day because I don't want to have to go see the dentist and have to give them a bunch of money.
Yeah. As an oral when on collections for oral surgery, I seem like that's probably because these are non-elective
mm-hmm.
treatments that, you probably see a lot of people that can't pay. So collections are probably less than in a general practice.
Yeah. And also we're a lot more incidence based, I guess you could say. So like people just come in
trauma
once.
Based, yeah.
Well, if somebody has, usually people come in for one specific thing, right? They've got a tooth that needs to come out. They've got a cyst that needs to be removed. They've got one specific thing that needs to be treated versus going to a general dentist where they're going to see you every 6 months or so. And, you develop a relationship and they actually feel like, you are contributing something beneficial to their life. People may be more willing to separate with their money than they are when, they're
it's
just
a
in
one-time
and out.
event. Yeah,
exactly.
And it's not something they were looking forward to anyway.
Yeah. But we do the best we can to try to make it a pleasant experience.
I mean, the same thing. Nobody wants, some people don't want to come talk about their money, but I make them.
Right. And they definitely don't want to pay you to tell them that they're doing the wrong things with their money.
Exactly. That's what most people's biggest hurdle is.
Yeah.
Do you want to go over, we have, as compensation models, we talked about the signing bonus.
Mm-hmm.
but there's this, you have that one. We have one example of the $20,000 signing bonus that you got from.
So and I'm sure you guys can find examples. The examples are they're not scarce. If you guys look for sources that kind of highlight people getting into these situations and how they work their way out of them, you can find them. I believe that this one is from that ADA
legal guide.
Yeah, the legal guide. But it's just kind of outlining what I was describing before. A dentist new graduate got accepted to a DSO. They're presented with their compensation package, and generally that's the thing that dentists are interested in, and that's the thing that they present to you. And that can be somewhat blinding because you get something that tells you you're going to make X number of dollars with a $10,000, $15,000, $20,000 signing bonus, and that all sounds great. But then, as we were mentioning before, once you actually get to the employment agreement and you look through these things, they may not always be as presented. And that's the main thing I want you all to avoid, is getting into a situation again where you are now liable for paying for something you didn't realize you'd be liable for paying for, such as repaying that retention bonus, or having to pay for your own lab fees.
Oh, yeah.
Or
paying your own CE.
Yeah, paying for your own CE. Or like Brian mentioned earlier, there was... Sorry, that just threw my train of thought. You said something about someone earlier.
Oh, the restrictive covenants are limited in practice.
It'll come back to me.
Yeah,
it's okay. We can keep going.
Yeah, I mean, there's all sorts. I think there's all sorts of examples. I have one example I'm going to review. I'm going to call her Dr. Emily, and we call this case study the unclear collections definition. So Dr. Emily, she was a new graduate, eagerly accepted associate position at a busy practice. The contract stated that her compensation was going to be 32% of collections, which I've seen higher or lower, but she viewed that as an attractive offer. But the contract lacked clear definitions of what collections were. So Dr. Emily, she soon realized that the practices, billing and collection practices, were complex or not efficient. And the office manager applied various deductions to the collections before calculating the doctor's pay. Some examples of those deductions were insurance write-offs, the difference between the billed amount and the amount the insurance paid, patient discounts that she was unaware of, credit card processing fees, and a percentage of the lab, even though she wasn't directly responsible for the lab bill. So the result was her take-home pay was actually significantly less than she anticipated. She obviously felt misled and demotivated, which affected her job satisfaction and her performance, which is not good for patient care. And when she raised the issue to the practice owner, they cited the contract's vague language, leaving Dr. Emily with little recourse. Right?
Yep.
They purposely had it vague.
Yep.
So this one example has some lessons. Right? The case highlighted the critical importance of clearly defining key terms in a contract, especially collections in a compensation agreement. You must ask detailed questions and seek specific examples to avoid, the misunderstanding, and avoid vague language. Like you don't want a contract with this vague language. You want them to put it in specifically.
Because if it's too broad, then a lot of law is open to interpretation. So if they don't specify these things, then you basically have to hope that your argument is better than their argument and their lawyer's argument. And if this is a large group practice or it's a DSO, they have lawyers. Like they probably have multiple, and they've done this multiple times with multiple doctors. And and just as a point that I was thinking of, these are businesses that we're working with and we're working for. I don't think that they're bad by any means. There can definitely be bad instances and bad actors who have the intention of taking advantage of people. But you have to remember that they are businesses, and their main goal, while one of their goals is and should be,
treating patients,
exactly, giving optimal patient care, they still run a business and they still need to make money. And if they can hire you for $50,000 a year, that's exactly what they're going to do, because it accomplishes their goal of treating patients, and it also helps their business to make money while saving money by not paying you. It is our responsibility to recognize what our value is, what we contribute to these offices, and also, what's fair and what's reasonable. Because I don't think most of us are asking for anything more than what's fair and what's reasonable.
Most of us.
Yeah, most of us. Hey, if you can get it, you can get it.
Yeah.
I'm not going to tell you. If you ask for a $50,000 signing bonus and they give it to you, perfect. I have no notes. But in general, I think that the fact that we don't get a lot of education about these things just lends us to being taken advantage of in subtle ways that it may not feel very big to us, but once you do things like, once you do the math on it, and you extrapolate it over the course of your entire career, it ends up making a significant difference.
Yeah. And sometimes these smaller practices, their contract agreements are vague by accident, right?
Sure.
Like, so like, for example, a doctor might have you agreement and not even think about, maybe you're the first associate he hires, and he hasn't thought about what putting, if you're doing 32% of collections versus, let's say, 32% of production, like he might not realize how big of a difference that is. And most of the ones I see, neither of us are lawyers, so we don't see a million of them, but most of the ones I see are collections, but I have seen some production ones. Like you can get it on production. And then you're not relying on, poor office manager or, the insurance specialist, relying on them. You go there, you produce, you get what you pay for. It's the doctor's, concern about
responsibility for making sure that, exactly, that they collect and they keep the lights on.
So, if you can get on production, that's obviously better. For example, this Dr. Emily lost tons of money that she could have gotten because of the ambiguous terms. Because of that, her whole financial plan kind of went out the door. She had trouble paying her student loans.
And I think beyond the direct, obvious financial implications of that, you got to think about and talk about the burnout.
Yeah,
because she's still got to get
emotional cost to that.
Yeah, she's still got to get up and go to work. She's still got to get up and go treat patients and try to take care of them to the best of her ability, and be proficient and do well at her job. And she's doing so with the realization that she is in a situation that does not benefit her as much as she thought it did.
Yep.
So, that definitely can weigh on people. And that's the thing that, like, we don't want there's enough stuff to worry about at work in the first place. We don't want people having to deal with career dissatisfaction because we just weren't provided with this knowledge, going through our training.
Yeah. If ever, the whole world would be a better place if everybody who shows up to work is satisfied, especially in the dental profession, right? Because it's a more durable experience. You have less stress. Hopefully also you're making a decent amount of money, so you don't have financial stress that you can take to work or take home. But then ultimately, if all the people are happy and and doing the right things, and have goals, then the patients ultimately get that care.
Yeah, absolutely.
So that's it's like you have to have happy staff first. Some people say happy patient first, but you got to have happy staff first to have happy patients. Every part of that experience, that from the, the welcome to the care to the outro, should be seamless and smooth. And if you're hiring associates or you are an associate, it's important to feel appreciated. And that starts, it starts with money, but it also doesn't end there, right?
Agreed. And speaking of seamless and smooth outros,
yeah,
we're about at our time here for today.
Yep.
So we are very appreciative of all of you for listening. If you have questions, please write us questions. Our emails will be in the show notes. We want to hear from you all. We want to talk about the things that are concerning to you all. We will delve into these things ad nauseum if you guys want us to, just so that we can make sure we're driving these points home to try to help people avoid some of these issues that we've seen other people make year after year after year after year. So the next time that we join you all, we're going to be
part two.
We're going to be diving deeper into contracts. Maybe a little bit more dry, but probably a little bit more important than what we talked about today. Just really getting into specific terms of the contract agreements and red flags, similar to like the broad terminology or vague terms used in some of these things, just to try to help everybody understand what they're looking at, how to go through a contract. So when you are ultimately with your advisors, you're on the same page. You understand what they're talking about, and you don't have to just trust that they are doing the right thing and that they understand all the implications of the agreement you're about to sign.
And if you, in the next episode, if you stick with us through the basics of contract, the legal stuff, we'll get in the fun part about negotiation and the mindset around negotiation. So we're looking forward to it. Also in the show notes, we'll have two things that you can download. We have a dental contract checklist. So if you're, in the middle of reviewing a contract or think that'll happen soon, but we also have a white paper on the top 5 contract clauses that can derail your employment or your career, at least at the beginning. So take a look at those in the show notes.
We should. I'm going to throw that ADA legal guide in there too.
Yeah.
We'll
put a link to that.
Yeah. Cool.
But yes, like and subscribe the show. Tell your friends, colleagues to listen in. It'll be some good stuff. So we look forward to seeing you on the next episode. Thanks. Seeing us on the next episode. Yeah. We look forward to you tuning in.
Yeah. We'll see you guys next time. Take care.